This is my Who Knew It assignment, and I'm going to be talking about the different types of diabetes. First, we have type 1 diabetes, and this is the diabetes formerly known as juvenile diabetes or insulin dependent diabetes. In type 1 diabetes, the immune system destroys the cells that release insulin, eventually eliminating insulin production from the body. Without insulin, the cells cannot absorb glucose, which is sugar, with which the body needs to make energy. The only treatment that you can give someone with type 1 diabetes is insulin, and type 1 diabetes symptoms are usually seen in childhood, and this disease cannot be prevented. Type 2 diabetes, which is formerly known as adult onset or non-insulin dependent diabetes, can develop at any age. It's mostly common in adulthood, but type 2 diabetes is rising in children. Most people who are diagnosed with diabetes in general are mostly diagnosed with type 2 diabetes. In type 2 diabetes, the body is unable to use the insulin, so this is called insulin resistant. And as type 2 diabetes gets worse, the pancreas may make less and less insulin. This is called insulin deficient. With diabetes, you can get many complications from diabetic neuropathy, which is the affects the nerves in the body because of the high blood sugar levels from the disease. This can lead to having wounds that don't heal properly or they don't heal at all. And having wounds that don't heal can lead to an infection, and a person could need to have a limb amputated. Type 2 diabetes can be prevented. The patients are encouraged to eat healthier, exercise, and have a well-balanced meal. The type of diet that people with type 2 diabetes are usually on are a consistent carb diet. This means that the person is supposed to have just about the same amount of carbs every day in their diet. So they're allotted a certain amount for breakfast, lunch, and dinner and snacks. And the last type of diabetes is gestational diabetes. This is diabetes that women develop during the second or third trimester. The women, they don't have type 1 or type 2 diabetes, but they do have gestational diabetes, and you only get this during pregnancy. And the only way to, get rid of this type of diabetes is to, have the baby, give birth to the baby. The woman is usually put on a consistent carb diet, just like type 2 diabetes, so they can control their dietary intake. The woman needs to go for regular checkups, to the doctor, and check on their blood sugar levels, and to get the baby checked out. And usually these women have babies who are at least like 9 pounds or so. That's it. Thank you so much.